Kyle. My name's Kyle.
My name's Nick.
My name's Cassandra.
My name's Axel.
So today we're going to talk about dissociative disorders. So dissociative disorders are an involuntary escape from reality. It's when you have a dissociation from your thoughts, your conscious, your identity, and everything that makes you who you are, basically. And that comes from the American Psychiatric Association. Okay. So to begin, the symptoms are pretty general until you start getting into the different types. So they usually develop after traumatic events that happen, like either in your childhood, which is usually when it happens. It includes memory loss of time. You forget people, you forget events. You have like gaps in your memory, like you forget what happened. So you get detached from your identity, right? It also causes more health problems like suicide, mental illnesses, depression, anxiety, things like that. And the symptoms usually depend on what type of disorder you have. So the first one is going to be dissociative amnesia, and that's basically when you forget everything. So when you have amnesia, you don't really remember what's happening. So with amnesia, dissociative amnesia, you forget who you are, you lose your identity, you forget. It's like you're watching a movie of yourself and you don't really know what's going on. It can be sudden, it can last minutes, hours, days, months, or even years. The next one is going to be depersonalization disorder, and according to NAMI, this is going to be feelings of detachment from your identity and from who you are. So you depersonalize yourself, so you're not yourself anymore, you're like somebody else. Everything feels unreal as well for that one, and this can last you your entire lifetime, and it can be on and off. The last one is dissociative identity disorder, and this is when you have two or more identities. So like in the movie Switch, where he had several different identities. They have different voices, they have different ways of showing themselves, different personalities, stuff like that. When you have dissociative identity disorder, you forget. So your identities are completely different, and what one identity does, the other one most likely will not remember, so they're completely different. And more women than men get this. So the men show more violent symptoms than women, and it's easier to diagnose a woman for this. So the main causes for dissociative disorders are going to be long-term abuse, so mental abuse, physical abuse, sexual abuse, all the types of abuses. Also natural disasters and combat, and this is according to the American Psychiatric Association. The diagnosis begins with a physical test. So they first rule out to make sure you don't have any other reasons for having like any type of memory loss. So then if it's not anything physical that happened to you, they turn you over to a mental health specialist, and that's when they compare your symptoms to the criteria that is set in the book called The Diagnostic and Statistical Manual of Mental Disorders, and this is published by the American Psychiatric Association. Okay, so the treatments begin with psychotherapy. So that's basically when you speak to a therapist and you talk about all the trauma. And when you speak about your trauma, this helps because usually trauma is the main cause of dissociative disorders, because you went through something so stressful that causes you to like get these disorders. Also, finding new ways to cope with stress, which is also a factor in getting these disorders. So you find new ways to talk to someone and manage your life. And they also have medications. So they don't have any medications specifically for dissociative disorders, but they have like antidepressants, anti-anxiety meds, antipsychotic meds, and things like that you can use. So in conclusion, it's really rare. Only about 2% of the population gets any type of dissociative disorder. It can affect anyone, and it usually affects people under 20 because they're younger and they experience something traumatic in their childhood. People can live with these disorders by using the right resources, by finding somebody to talk to, and by learning to cope with the basis of what caused the disorder. So it's very important to stay educated, to keep a journal of yourself, to know yourself and know your identity. So if anything does happen with any type of mental illness, you know what you're talking about and you know what's going on with you. And that's everything.